Every day, you may be hearing about new, exciting treatment options for the novel coronavirus, also known as COVID-19. While there is reason for optimism, we also have to acknowledge the limitations of these claims since they have not yet been verified in clinical trials of patients with COVID-19. To illustrate why clinical trials are important, suppose we have a new drug that we'll call Stopaviricivir. We'll give it a fictional trade name, Stopavir, to treat a fictional virus X. It appears that virus X patients are very sick and they take 2 weeks to feel better, on average. However, let's say we give Stopavir to 10 patients and they took only a week to feel better. Sounds great, but are those 10 patients representative of the population as a whole? Were they healthier than the average population and that's why they got better? Were they on different treatments other than Stopavir and that's why they got better? Was it the Stopavir that helped them get better? More definitively answer this question, the gold standard is a randomized controlled trial. Treatments that have promise need to be compared against the current standard of care. On March 18th, the week this video was uploaded, a paper in the prestigious New England Journal of Medicine reported results of a randomized controlled trial comparing the combination antiviral regimen lopinavir-ritonavir versus a control group of patients who had the usual care. 199 patients with confirmed COVID-19 were randomized to receive either the experimental regimen or usual care. In the end, when comparing patients who received the combination antivirals compared to the control group, there was no difference in time to clinical improvement. There was no difference in the proportion of patients who died after 28 days of follow-up, and there was no difference in the amount of viral RNA found in the blood. That's not to say we shouldn't be cautiously optimistic for new treatments, but it is preferable that these treatments are given in the setting of a clinical trial when available. Giving treatments with little evidence could expose patients to serious side effects while providing no benefit. Admittedly, sometimes we do not have the best evidence, such as a randomized controlled trial, available at the time we make clinical decisions. This is the case with rare diseases or new diseases, such as COVID-19. In these instances, we make the best judgment given the evidence available in considering the patient's preferences and values. And if we are to practice good evidence-based medicine, we have to continually reevaluate our conclusions and practices as new studies and evidence are reported. I made this video to explain to the non-medical public the importance of evidence and clinical trials in determining drug efficacy. If you find this content useful, please let me know in the comments below.